Have you ever wondered what the earliest known usage of medicine was? The dawn of medicine is a fascinating tale that takes us back to prehistoric times. Back then, our ancestors relied on nature for their remedies. Their pharmacy was the world around them: plants, animals, minerals, and even rituals. They used herbs to treat various ailments, and these herbal remedies, believe it or not, form the basis of many modern medicines. As societies evolved, so too did our understanding of medicine. We journey to the banks of the Nile, where the ancient Egyptians were making significant strides in the field. They had a remarkable grasp of human anatomy, thanks to their practice of mummification. This process, albeit morbid, allowed them to understand the body's inner workings, contributing to their medical knowledge. From papyrus scrolls, we have learned that they could treat wounds, fractures, and even perform simple surgeries. Next, we move to ancient Greece, a civilization famous for its philosophers and scholars. Here, medicine was viewed not just as a practice, but as a science. The Greeks introduced the concept of clinical observation, a cornerstone of modern medicine. They believed that diseases had natural causes and could be treated through understanding these causes, a radical departure from attributing illnesses to supernatural powers. Among these Greek scholars was a man named Hippocrates, often called the father of medicine. Hippocrates revolutionized the field by promoting the idea that ethics are fundamental to medicine. The Hippocratic Oath, named after him, is still recited by doctors today. It's a pledge to uphold specific ethical standards, including treating the ill to the best of one's ability and respecting the privacy of patients. By the time we reach the Roman Empire, medicine had evolved from a mixture of superstition and empirical practices to a field of study with a more systematic approach. The Romans, with their advanced infrastructure and public health policies, further propelled the evolution of medicine. With the rise of the Roman Empire, medicine took a turn for the better, setting the stage for further advancements. And as we'll see in our next segment, these advancements were only the beginning of a journey that would lead us to the sophisticated medical practices we know today. As the Dark Ages descended, how did medicine fare? Well, it was a tumultuous time. With the fall of the Roman Empire, medical knowledge took a hit. Superstitions and religious dogma often overshadowed scientific understanding. Diseases were seen as divine punishment, and treatments often involved prayers, charms, and amulets. Physicians were few and far between, and their knowledge was often limited to what they could learn from ancient texts, which were scarce and difficult to access. However, despite the challenges, there were some advancements. Monasteries became the centers of medical knowledge and practice, where monks grew medicinal herbs and treated the sick. The Islamic world, on the other hand, experienced a golden age of medicine. Scholars like Avicenna and Rhazes made significant contributions, preserving and expanding upon the knowledge of the Greeks and Romans. As we transitioned into the Renaissance, the world witnessed a resurgence in medical knowledge. The dissection of bodies became common practice, allowing for a deeper understanding of human anatomy. This period also saw the rise of great minds like Andreas Vesalius, whose detailed works on human anatomy laid the foundation for modern medicine. The Renaissance was also a time of exploration and discovery. New plants and herbs were brought to Europe from the Americas, expanding the pharmacopoeia. The printing press, invented in the mid-15th century, allowed for the wider dissemination of medical knowledge. For the first time, medical texts were not just available to the elite, but also to the common man. Despite these advancements, many aspects of medicine during this period would seem primitive to us today. Bloodletting and leeching were common treatments, and surgery was a last resort, often performed without anesthesia or understanding of germ theory. But change was on the horizon. The scientific revolution was brewing, setting the stage for a more systematic and empirical approach to medicine. As we moved into the 19th century, medicine started to look a bit more familiar. How did cowboys and pioneers deal with medical issues on the frontier? Life in the Old West was harsh and unforgiving, making medical care a critical aspect of survival. However, formal medical practice was largely non-existent. Instead, settlers relied heavily on home remedies, passed down through generations, for treating common ailments. Herbs, roots, and other natural ingredients were the backbone of these remedies, often guided by intuition more than scientific understanding. In fact, the line between medicine and folklore was often blurred. Traveling shows featuring self-proclaimed doctors peddling miracle cures were a common sight. These snake oil salesmen, as they were known, capitalized on the desperation of those suffering from illness. Simultaneously, Native American tribes had their own version of a healer, the medicine man. These individuals held a sacred role, using a mix of spiritual practices and herbal knowledge to treat their communities. With the dawn of the 20th century, medicine was about to take a giant leap forward. In just 70 years, how far has the science of medicine come? It's a question that invites us to marvel at the leaps and bounds made in the field during the 20th century. A century that saw a rapid acceleration in the development of medical science, transforming the way we diagnose, treat, and prevent diseases. One of the most significant breakthroughs was the discovery of antibiotics. The story begins in the late 1920s with Alexander Fleming's serendipitous discovery of penicillin, a mold that killed bacteria. This marked the dawn of antibiotics, which became widely used during the Second World War, saving countless lives from previously fatal infections. Next, let's talk about vaccines. The 20th century saw the development of vaccines for a multitude of diseases, from polio and measles to hepatitis and influenza. These vaccines have drastically reduced and in some cases eradicated the diseases they prevent, saving millions of lives each year. We can't discuss the 20th century without touching on the advancements in surgical techniques. The development of minimally invasive surgery, the advent of organ transplants, and the refinement of anesthesia have revolutionized the world of surgery. This era saw the first successful kidney transplant in 1954, the first heart transplant in 1967, and the first minimally invasive gallbladder removal in 1987. These advancements have increased the success rates of surgeries and improved patients' quality of life. Of course, these advancements have had a profound impact on our life expectancy. At the dawn of the 20th century, the average life expectancy was around 45 years. By the end of the century, this number had almost doubled, reaching nearly 80 years. This dramatic increase can largely be attributed to the advancements in medicine, from antibiotics and vaccines to surgical techniques. As we look to the future, what can we expect from the field of medicine? Indeed, the 20th century laid a solid foundation for the future of medicine. With the current pace of innovation, the coming years promise revolutionary breakthroughs that will continue to extend our lives and improve our health. What does the future hold for medicine? As we look to the horizon, several promising developments suggest a future where medicine is more personalized, precise, and proactive than ever before. One such advancement is personalized medicine. Imagine a world where treatment plans are tailored to your unique genetic makeup, lifestyle, and environment. No more one-size-fits-all approach. Instead, we could be looking at a future where your DNA is the blueprint for your healthcare, minimizing side effects and maximizing treatment efficacy. This is the promise of personalized medicine, a future where your health is as unique as you are. Another exciting avenue is gene editing. Techniques like CRISPR-Cas9 have revolutionized the way we think about treating genetic diseases. In the future, doctors might be able to edit out disease-causing mutations in our DNA, effectively curing conditions like cystic fibrosis, sickle cell anemia, and even some types of cancer. The possibilities are vast, but so are the ethical implications. How do we ensure the responsible use of such powerful technology? Lastly, let's talk about artificial intelligence. AI has the potential to revolutionize diagnostics. Imagine a machine that can analyze a patient's symptoms, medical history, and even genetic data to diagnose diseases with an accuracy that surpasses human doctors. We're already seeing AI make waves in radiology, pathology, and even mental health diagnosis. This could lead to faster, more accurate diagnoses, and ultimately better patient outcomes. However, these advancements also present new challenges. How do we balance the benefits of personalized medicine with the risk of genetic privacy? How do we ensure equitable access to these cutting-edge treatments? As we move forward, we must grapple with these questions and more. In conclusion, the future of medicine is a fascinating blend of promise and uncertainty. As we continue to push the boundaries of medicine, who knows what the future holds? Whatever it is, one thing is certain: we're in for an exciting journey. The history of medicine is a testament to human ingenuity and resilience. We've journeyed together from the dawn of medicine, where our ancestors relied on herbs and rituals, to the Middle Ages and Renaissance, where the foundations of modern medicine were laid. We've galloped through the Old West, where the medicine man held sway, and witnessed the phenomenal advancements of the 20th century that revolutionized healthcare. In just 70 years, we've seen progress that our ancestors could only dream of. From the discovery of DNA to the development of antibiotics and vaccines, our lives have been irrevocably changed, and we're living longer, healthier lives because of these advancements. Looking forward, the future of medicine is a thrilling prospect. With technologies like gene editing and artificial intelligence, who knows what breakthroughs lie just around the corner? As we journey into the future, the story of medicine continues to unfold, promising a healthier and longer life for all of humanity.